one time we had a world-class swimmer who had Olympic aspirations, and then physical health conditions kicked in, and then subsequently mental health conditions kicked in, and she'd gotten away from swimming altogether. And it was such a passion of hers, and she loved it. And even if she knew the Olympics had passed, that it just made her feel so much better. But she was
Yeah.
so distraught at the toll that her physical health conditions took on her, and it could in her mind robbed her of the chance to compete for the Olympics. She just got away from swimming altogether. And we were
Mm.
all quite proud and quite touched when she told us while in program that, based on the encouragement of her peers and staff, she got back into the pool. And by the her discharge ceremony that we had, she was tearfully telling us how glad she was that, thanks to us, she said she rediscovered the water.
Welcome to Find Empathy. This episode introduces something new. In the past, we have delved deep into topics like MS and rare neuroimmune disorders. We also have episodes that present the audio from live didactic webinars. We will now be interspersing single episode topics where we interview experts that are doing unique and exciting clinical or research work that integrates physical and mental health. Today's podcast introduces the Young Adult Medical Track program led by Dr. David Bendor at Hartford Hospital Institute of Living, a program designed for individuals aged 18 to 26 dealing with both physical and mental health issues. Dr. Bendor describes the program's origins, mission, and structure. He shares patient success stories highlighting the unique challenges faced by young adults with co-occurring conditions, and details the therapeutic models used in the program. Dr. Bendor also discusses the program's logistics, insurance considerations, and potential for future expansion. I was really excited to learn about this unique program. I hope you enjoy the conversation and subscribe so you can be alerted when new episodes and topics are published. Today, I'm happy to introduce Dr. David Bendor, a psychologist from the Hartford Hospital Institute of Living. He'll be sharing insights into the Young Adult Medical Track program, a specialized initiative for individuals aged 18 to 26 dealing with both physical and mental health issues. Dr. Bendor, thank you so much for being here today.
Thank you for having me.
I wanted to start off by asking you to provide a little bit of information about the Young Adult Medical Track program. Can you just give me an overview of its mission and how it supports individuals with physical and mental health issues?
Yes, I can, and if it's okay, I'll give a little bit of the history of how we got started.
Great.
The Several years ago, this is all prior to COVID. Several years ago, some donors had actually reached out to our system and were looking for places they could help out. And they obviously, several of us across the state, submitted some ideas, and they were really keen on this program where we proposed. Um, Offering a young adult program, an intensive outpatient program, a 3-day a week day treatment program, where we could treat young adults with co-occurring physical health and mental health conditions. Um, this came about because for years I had been in what we call the young adult general track, which is a young adult program, similar ages 18 to 26, with any mental health condition that's impacting their quality of life, impacting their ability to do school or work. And so, as you can imagine, we see a whole host of young adults coming through all different backgrounds. But what we were consistently seeing, and about I'd say maybe 10% of them pretty consistently, that there were young adults coming through with, in addition to their mental health conditions and diagnoses, had pretty significant physical health conditions and diagnoses, especially, I can off the top of my head, like Crohn's and chronic pain and diabetes. Um, and We thought, well, wouldn't it be interesting to have a program that really focuses on these young adults and can offer them something unique that we didn't know of in the area? So I put this all in the proposal to the donors, and obviously they went with our project in addition to several others. And so we launched a young adult IOP in, I'd say, the fall of 2019. And we had health psychology and nursing and psychiatry, and I was there as the role of clinical coordinator of the program, a psychologist as well. Um, and that's really how we launched, and we came up with a unique and what I think is a quite robust curriculum, and launched, like I mentioned, in the fall of 2019. Of course, a few months later, COVID came through and changed things pretty significantly. But I'm happy to say that even prior to COVID hitting, we were at capacity. So we were clearly meeting a need that was there in our community.
Excellent. This is such a great program. I mean, I've come across multiple patients that I've worked with specifically who need intensive outpatient programs and who ideally would love a program where the people involved understand both their medical condition as well as the mental health side. And I just don't know a lot of programs. Like I actually can't find one similar to yours. And I'm just wondering, are there other programs like yours around the country, or is this pretty unique?
Well, I know, and again, my what I'm about to tell you might be a little dated, because I was doing this research right back in 2019. But in terms of our model, in terms of kind of who could I go to, who could kind of mentor me on this process of launching and staffing and developing a curriculum,
Yeah.
we went to the other coast. We went all the way over to California, literally the furthest point from Connecticut, and we reached out to some colleagues, or who are I can now call them colleagues out at Loma Linda, and they had a young adult program. No, sorry, not a young adult program. They had a young person's program, like a child adolescent program. For young adults with these co-occurring conditions. So that's one. They told us about one in Chicago. I never connected with them, so that's two. Mind you, we're all the way in Connecticut. And then interestingly, there is a co-occurring condition, for physical health and mental health in Rhode Island, where I had
Mm,
done some training, and it's a PHP
yeah.
for kids with these co-occurring conditions. And coincidentally, the psychiatrist there had trained and done his training and at the Institute of Living where I am. So that was a very easy connection to make. I had some ties to the area. Of course, the psychiatrist had some ties to the area. So that was a connection as well. But we're talking about, as of 2019, I learned of four in the country, ours being the
Yeah.
fourth.
Yeah, I mean, I did some extensive research recently, and for a few of the people I'm working with, and I really came up empty. So this is such a valuable resource. Can you share some of the common mental health challenges that you see in the individuals that are coming into your program?
Yes, I definitely can. And what's interesting is, we get young adults where, and they'll use their own terminology, but basically during their time in the program, they're leaning a little more heavily into their physical health conditions and how those are impacting their mental health. And then we have other
Mm,
young adults who come through and talk about their mental health conditions, and it's making it harder for them to manage their physical health. So kind of both sides of
interesting.
obviously a connected story. It is very interesting because when I talk to new young adults coming in, I'll tell them that, and they'll say, "Great, I have this physical health condition. I've been dealing with it. It's been chronic. I know it's taking a toll, but I'm really here to talk about my anxiety and my depression." And those are, I think, are the primary diagnoses that come through. Whereas others will say, "I just got this diagnosis, this physical health condition. It's really thrown me off. I was never depressed or anxious before. All of a sudden, I am. Please help." So very different presentations, but fortunately, they find a lot of common ground once they come into our program. So I'd say primarily it's depression and anxiety. We do, like in the regular population, we do get folks with bipolar disorders and psychotic disorders who come through who have those who have those mental health conditions as well as their existing physical health conditions. But I would say primarily we're looking at various types of depressive disorders. Maybe for those new diagnoses, we might see adjustment disorders with more of a depressed presentation. Um,
Yeah.
and obviously the anxiety disorders.
Okay. And what about, I know you mentioned Crohn's, but what are some of the most common medical conditions of the individuals that join your program?
Yeah, so we get a lot of referrals from GI,
Mhm.
and they're often pretty good. The folks who come from them have already heard from their docs, about the mind body connections and how their anxiety can cause flare ups and things like that. We get a lot from endocrinology because we have young adults coming through with diabetes type 1,
Mm,
and they've really struggled due to the fluctuations in their mood and how they're doing emotionally. They've really struggled at times with managing that. And obviously, at times when they don't manage it well, they end up in ERs and in pretty dire situations. And so we get a lot of referrals from endocrinology. We get a lot of referrals from oncology with patients who have ongoing cancer diagnoses as well as cancer in remission or fully in remission. But maybe those treatments, took a real toll on them, on their physical selves as well.
Yeah.
So those are probably my top three. I get a lot from neurology because
Mm.
we get young adults coming through with seizure disorders and migraines disorders. We'll get So I'd say those are probably my top four. But then, as I'm looking, we'll get folks from transplant. We'll get folks from cardio, um,
Mhm.
and like I mentioned, chronic pain kind of is fairly pervasive among all the young adults who come through.
Right. And maybe this is just a personal interest of mine, but you mentioned neurology. Do you have any limitations in terms of individuals who have some cognitive impairment for seizure disorders or other neurologic conditions?
Yeah, so really the way we'll do a couple screens and I'll do it in my role as clinical coordinator. Frankly, I really enjoy this being kind of the first point of contact. I'm happy to talk about the program. I'm happy to answer any
Yeah.
questions. I'll talk to family members, like for a couple of reasons. One, because I just want to make the connection with these folks. I'm very proud of the program, and want to tell them all about it and answer any questions they might have before they make the decision to make a significant commitment. And then in addition to that, we do more of a formal intake. And then, if everybody, all parties agree, then we move forward with an admission. And really what I tell them is, the criteria, they have to be able to participate in groups.
Yeah.
Um, and there can be more didactic groups, skills-based groups, cognitive behavioral groups, some more insight-oriented groups. But if they're able to participate in groups, and I tell people they don't have to be the most vocal, they don't have to be the most articulate. They just need to be able to, understand what's going on and participate, and ideally, not feel more overwhelmed by the content or by,
Mhm.
the way the groups are being carried out. But that's primarily it. And then even the age, you gave the age at the beginning, and it's the age that we have on our brochures, that 18 to 26. But we've even taken some folks who are a bit older than that, because developmentally they fit with the milieu.
Okay.
I tell them what's going on and what the typical ages are, or even what the current ages are, and I leave it up to them. But what's neat for me in this role is at the Institute of Living, where I am, we have a number of young adult programs. So when I screen folks, I'm of course thinking about my program, but if it's thought they're not a great fit, I can move them along, if they're interested, to any one of several other young adult programs, which including others with specialty tracks. I mentioned the general track that I was a part of for several years. We also have an early psychosis slash major mental illness track. We have an
Mhm.
LGBTQ track. We have a co-occurring for substance abuse track. And, we leave it up to the young adult saying, this is what's available. Any one of these, perhaps, two or so could be a good fit. What do you think you'd be most comfortable in? And then we leave it up to them.
Great. That's a great way to start, get somebody involved and participating even from the beginning. So you mentioned you have a really robust curriculum. And so I'm wondering if you can expand on that a little bit more, kind of identifying what some of the key services are that are offered by the program, and just sort of what's involved from a psychotherapy standpoint too.
Yep, yep. So it's a group program. We run 3 days a week, Tuesdays, Wednesdays, and Thursdays. We start in the morning at 10 a.m. And go till about 1 p.m. and then actually have it set up so the young adults can grab lunch with one another if they'd like, which is another way to increase the connection that they feel with toward one another. Some could take that lunch to go, but that's a
Yeah.
typical day. It's a 3 hour day. And in the course of that day, we have three group sessions. Um, and in between, they may opt to meet with the lead clinician for some one-on-one. They may opt to, or the psychiatrist may look to meet with them about what's going on in terms of psychopharm. They might meet with our nurse slash case manager because they're working on some young adult life stuff in terms of, first jobs or returning to work or school loans or housing. So we want to make sure we're covering kind of any number of situations that could come up for young adults, not solely focusing on mental health and physical health, but also the quote unquote what I call the doing life stuff.
Mhm.
And then in addition to that, depending on where the young adults are and maybe their relationships with their family members or significant others, we can do family sessions. And so we might do those at the end of the day at that 1 o'clock time, or before program starts at 9 in the morning. And that's a chance for them to have family meetings, not necessarily ongoing, such as you'd find in family therapy, but periodic family meetings to talk about what the family members' observations are of the young adult, if they're seeing improvements, maybe they have some concerns that hope we want to address, that the young adult didn't think to bring up, and as you know, family members can just share a perspective that a young adult can't share on him or herself, and so we find those very valuable, and provide a lot of data. Um, and so that's, a typical a young adult, when I'm describing to them the program, that's what I'll tell them about in terms of their experience. The 3 groups a day, 3 days per week, the opportunity for individual check-ins, the opportunity for psychiatry and psychopharm, and the opportunity for family meetings. And we also tell them, because a lot of times they have this question, if they want to continue with their outpatient psychiatrist or prescriber, we say absolutely. Ours may
Mhm.
just, admit them on day one and check in from time to time, but the psychopharm continues in the community. Same with the one-on-one therapy. Our lead clinician can't offer, traditional psychotherapy sessions weekly or biweekly to all the young adults who are in the program at a given time. So we often encourage them, if they wish, to continue with their individual therapists, and we make sure to all stay connected so we can talk about what some of the goals might be in the 6 to 8 weeks that they're with us.
Okay. So that's a good way to kind of transition people out of the program too, if they stay connected with their individual providers in the community.
Yep. And then what we'll also do, if they come to us and they don't have them in place, maybe this is a first experience with mental health, or maybe that, they just, it's not a first experience, but they haven't had
Yeah.
any luck in identifying, as you and I know about shortages in the community.
Oh,
Um,
yeah.
Pretty much from go, when they come, if we know about that, we start looking and tapping into the resources we have just by being a part of this community for as long as we all have. We start looking at some resources for disposition planning, so that they ideally, if they're going to start with a new therapist or psychiatrist, they would start have those initial sessions while they're still with us, and start the transition out of our program. In addition to that, because a lot of the young adults make a real connection to us and our campus, we have what we call an aftercare group. Some call it the graduation group. I think I don't know what we have it down as formally, but it's the same concept where we're young adults who've gone through the program and thought that not only the program really helped them, but especially they really responded well to group therapy. They have an opportunity to continue within a young adult aftercare group, and that meets weekly, just for 1 hour a week. But again, a chance for them to continue with other young adults, at whatever frequency they wish.
Okay. And can you tell me a little bit about what you think is unique about this population? I mean, you worked in the general track, you've built
Yep.
this track. What is unique and what do you usually need to really pinpoint for the
Yeah.
individuals who come through this program?
Yeah, no, that's a great question. So really the reason we started this program is, as I mentioned before, seeing about 10% of these young adults coming through when I was in the general track with physical health conditions. And their stories were always unique. And I'll give some examples. There might be a young adult who is off freshman year of college, and
Mhm.
like the other young adults on their floor, there's some jitters about first year stuff and learning the ropes, and what you have to do, and to let off some steam, some of the young adults who all live on the same hall maybe like to take, I don't know, a drive to the beach or a mountain or go for a hike.
Yeah.
But the young adult that I'm talking about also suffers from Crohn's, and unlike the others, that young adult has to think about, is it okay to go? What if I need the group to stop several times because I need to find a restroom? And will there be an available restroom? And when we get there, will there be facilities? And what if I have really bad, cramps or whatever it might be? And
Yeah.
what is their comfort in sharing that? So what we were finding is some young adults would just pass on opportunities that they would really like to participate in because they were fearful of their symptoms flaring up and not necessarily knowing how to relay that to the folks that they may have just met. And so a lot of times we will get folks in the program who are, again, as I mentioned before, maybe freshmen in college who, have these concerns and these conditions, and what we find they're doing is they're isolating rather than going out and doing what they can. They're isolating out of fear of having any of those situations arise that I just described to you.
Yeah.
We might get a young adult, and I mean I know this one quite well. We'll have a young adult who comes from several generations of firefighters, for example,
Mhm.
and a grandparent was a firefighter, and a father was a firefighter, and he'd always thought he'd be a firefighter, but then he got a cancer diagnosis at a younger age, and in full remission now, but the treatment took such a toll on him, he just physically can't, carry the pack on his back, and he can't do a lot of the things. So, someone who went, the first, we'll say 15, 20 years of his life thinking this is what he would do. There's a family legacy and it's what he always wanted to do. And it's completely just taken away from him, or as he says, robbed for no
Mm.
fault of his own. That's a young adult who, we want to, if they're really struggling with that dramatic shift in terms of what they envision for themselves, that's quite a unique story. And we'll want, someone like that to come into our program and do our best to help them, what I say, develop a plan B or a plan 1A. We're not trying to say, it's going to be just as good as what you always envisioned, but could we
Yeah.
come up with something, help you come up with something that you would still find very fulfilling and interesting?
Right, absolutely. I mean, I think that's so valuable, and maybe that's something that I have a few people who've gone through traditional PHP or IOP programs, and they feel like it is sometimes missed in those programs. They don't always feel connected to other people who are there,
Yeah.
and are struggling for different reasons, but maybe purely more mental health challenges, and so it's a different animal for sure.
It is,
Uh,
and I'm
yeah, go
sorry,
ahead.
I just wanted to add, because I think you said it, you kind of quoted and cited exactly what we were finding, where these young adults would go through maybe other programs and say, wow, the other young adults I met, they were kind, they were empathic in the program, they were, sharing but they couldn't really relate to me. Excuse me,
Yeah.
they could say, that they were sorry to hear I was going through that, but the young adult would say, but I knew they were not going through it, and that, it made a difference for them in terms of connection. Again, nothing to
Mhm.
do about, the kindness that they were showing each other, but just that they knew that none of them were going through that experience. So to come to a program where they know that all the other young adults, while they all have different conditions, and different levels of acuity, all do have those conditions. And so they would come to our program and say, like literally on day one, they just, breathe this deep sigh of relief that this is a group they can really relate to.
Yeah. I've seen that in so many different places. I work, do some consulting for can do multiple sclerosis. And then recently did an interview with a few individuals, community members with rare medical conditions. And the theme I heard was, I just didn't want to feel so isolated and
Hmm.
alone. And so I
Yeah.
think you're sharing that similar theme that people want to feel connected and understood. I my follow-up question in terms of the curriculum is, are there any specific therapeutic models, like acceptance commitment therapy or DBT or CBT or others, that your program uses? And kind of how is that implemented in the group programs?
Yeah, no, great question. And so the answer to all of that is yes, and I would say to differing degrees. And so, if you took a look at if anyone took a look at our curriculum, there's an eclectic quality to it, and that's intentional. And so to answer your first question, yes, we have groups in the day, or sorry, groups in the day or groups in the week that do lean into more, acceptance and commitment therapies, DBT, CBT. So the answer is unequivocally yes. What
Yeah.
the challenge is because we have all these young adults coming through what is a single track program, meaning all the young adults who are admitted are in the same 9 groups a week. And so, as you can imagine, there's some who are going to really respond to different modalities more than others. And so, what we try to do is give them kind of a sampling. And I'll say it to them at times, or the group leader will say to them at times, we're going to do this today and explain what this is, and acknowledge that some of you will, might really respond to this. Some of you might say, sorry, been there, done that. Some of you will
Yeah.
just be puzzled. But what we ask them is just keep an open mind. And I'll say, even if you tried mindfulness 3 years ago and you said it didn't do anything for you, I'd encourage you while you're in this program, try it again when we run the group, give it a real try, because you're a different person 3 years later and your maturity's shifted, and et cetera, et cetera, et cetera. So we absolutely lean into all those different therapeutic modalities. We have, as I mentioned, like insight-oriented groups in terms of interpersonal process groups and identity process groups. What kind of person am I with these diagnoses, and also how do I present myself to the world and interact with others, and how much of this do I want to share with people, and how much do I
Sure.
want to keep this to myself,
Yeah.
as well as obviously the check-in groups that are common to many programs in terms of starting off the week or closing out the week in terms of how people are doing. And then all the other topics I can think of. We will do more didactic groups explaining what the biopsychosocial model is. We'll have groups explaining why nutrition might impact physical health and mental health, why the importance of sleep hygiene. And then we'll also, as you'd mentioned, maybe later in that same day, have a group where we're doing DBT skills and talking about how that can help them out interpersonally.
Yeah, absolutely. That's great. How did you develop the curriculum for the program?
So I took the input of several people. I reached out to folks. As I'd mentioned, I'd been a part of the young adult services in the general track for several years, and so in those years, our curriculum had been tweaked and modified, and we like to think improved over the years based on feedback we got from young adults, and other group leaders or group co-leaders. And so I thought I had a very solid foundation of what young adult programming would look like, and
Mhm.
then leaned into my health psychology colleagues, and of course the health psychologists I brought on board when we started the program to both tweak and also insert where appropriate, groups that were very specific to this population. So we have groups that apply to young adults because we never want to lose sight of the fact of, despite these diagnoses, they are young adults like every other young adult.
Yeah.
But also, we wanted to make sure to make our program unique that we address the specific concerns that a young adult might have with physical health conditions, as well as mental health conditions.
I'm kind of thinking about the transition into outpatient.
Mhm.
Um, do the people that you refer to have a health psychology background or something similar? And if they don't, so for example, if somebody's listening to this and somebody coming from your program were to enter their clinic, what do you think you would want those outpatient therapists to understand or know or implement into their practice?
Yeah, that's a great question. So there are a number of health psychologists I have on my short list, right? That either on my cell phone,
Yeah,
or I guess I don't know if I can use the term Rolodex anymore. That might be too
sure.
dated, but yes, definitely on my short list. I have some very competent health psychologists in the community. But absolutely, as you know, there's like with many, there's always a shortage, and there's never enough. And so there are plenty of clinicians we will reach out to who they're not necessarily health psychologists by training, but they have been around young adults enough, in our case, young adults we're talking about.
Yeah,
And just by virtue of treating young adults for 10, 15, 20 years in the community, they've, of course, encountered young adults who have, co-occurring physical health conditions. And so if these are solid clinicians and they are open-minded, they're empathic and compassion, and especially curious, I really want clinicians who are going to ask the young adult, well, what has really try to get a sense of what their experience has been living with these co-occurring conditions, and not making any assumptions about what that's been like. So if I get, bright, thoughtful, insightful, curious clinicians, they're on my short list as well. And I look for feedback, and often when we do follow-up calls where we'll reach out to a young adult who's discharged from our program a month out or 3 months out or 6 months out just to check in how it's going. Often
yeah.
those young adults that we've paired with those clinicians I described to you are quite happy, and will tell us that things are going quite nicely.
Now, is your program primarily or fully in person, or do you also offer virtual options?
Right. So we've gone back and forth. Obviously, I was going to say in 2019, before anyone knew what a virtual program would look like,
Yeah,
right? We were all in person until March of 2020, and then we were actually one of the first programs on our campus to shift quickly to virtual. And then over the subsequent several years, depending on what the hospital guidelines were and CDC and all that, we're kind of shifting between completely virtual programming to in-person hybriding it, where we'd have, hopefully with little lag, a few people might be on the screen in the group room while others were sitting around the room 6 feet apart with masks. It's quite a sight to behold. And again,
sure.
only this day of COVID. We had the aftercare group I described to you was virtual, and continued as virtual for quite some time, until there's kind of a chorus of young adults in the program saying, no, look, we want to get back in the building. We want to see each other in 3D, in the flesh and blood, and whatever terms they use. And so that's gone back to completely in person. And the program as well, we started to put out feelers for a virtual IOP in addition to this in-person IOP. And we reached out as best we could and reached out to providers, and we were getting fairly consistently the feedback was, COVID was so hard. I want nothing else but to get back in person. So as of right now, we are fully in person. That being said, though, I'm always concerned about the young adult who can't drive or
Yeah.
can't go for rides that are more than 30 minutes, right? Or are just a part of the state where it's just not realistic that they're going to come do round trips to us 3 days a week. So if the demand is there and we track the calls we get, we track the people who I screen, and if they say, oh, I was really just looking for virtual, I make a note of that because I want to track how many calls I'm getting that unfortunately we're turning away because we don't have virtual. But as
Yeah.
of now, we're solely in person, but I'm absolutely open to, and we learned during COVID that we can adapt our curriculum to a virtual model.
Right. Absolutely. Yeah, I mean, I could imagine, even, with PsyPact, although there's probably, licensing and,
Yep.
um, also insurance barriers there, but even people from out of state might be interested in a program like this if it
We've
was
actually had
virtual.
people from out of state come to us, and they've stayed with a handful that I know have stayed with relatives, have stayed in temporary housing. So we've had a number of folks come to us who took leaves from school, for example, who come to us from out of state. But yes, to our shared point, they were physically in person to do that. And again, like I said, you're right with SciPac and maybe the other disciplines will head in the SciPac direction shortly. Kind of the sky's the limit is my hope.
Mhm.
Um, but for now, anyway, we are in person.
So if people are coming from out of state, does the program or the hospital help with finding, temporary housing, or is that kind of on the person or the family?
No, we can help. I mean, we have some options for, because we're part of a large hospital system, there are obviously there's times when family members might come in for any of these physical health conditions that, you and I have talked about for treatments
Yeah.
or long, so fortunately, but when I launched this program, I was able to learn more about what just Hartford Healthcare offers that I just wasn't aware of because I didn't really have a need to learn. And so I did learn about where more affordable temporary housing is offered. And so when there is a possibility that someone wants to come in and will need a place to stay and they don't have family, I do tell them about some of the options. So that's something again I look forward to doing in my role as coordinator and that first contact. And I like being able to tell people, yeah, we do have a few options. It may not work for everybody, but at least I can tell them more than just, good luck, you're on your own.
Yeah, absolutely. That's great. That's great to know. And obviously, you've shared a few, like kind of snippets of case stories, but I'm wondering if, keeping obviously HIPAA in mind,
Mhm.
would you mind sharing, a case or some examples of people who've gone through the program and have benefited from it?
Sure. I think some of the ones that we collectively are quite proud of are the ones who've taken a leave from. I like to call it when I tell others who ask the question you asked. It's a leave. They took a leave from blank. All right. So
Uh-huh. Yeah.
that could be grad school. It could be senior year of high school. It could be undergrad. It could be a job, and we've had a lot of success helping those young adults during their time off. Um, Obviously providing them structure so they're not just sitting at home for those 7 days a week that they now have freed up, but we're providing them structure and providing them treatment. And we have had quite a lot of success helping those young adults transition back either from whence they came or a different school slash job that is a better fit at this stage in life. And so, we'll have folks who are, and as I mentioned, as you and I are talking, of course, we're, a mental health program. We have a lot of
Yeah.
folks, obviously, with significant physical health problems, and we're very clear that we are a mental health program and that the mental health treatment we do often helps aspects of living with the physical health conditions they have. And so, as I mentioned to you earlier, at times we have young adults who are, quite profoundly depressed or quite profoundly anxious, or what, I left this out when you asked me at the beginning, or have clear-cut symptoms of PTSD
Uh-huh.
related to the diagnosis, the treatment, the experience of the treatment. And so for those young adults, there's a lot of ambivalence about getting back into work and getting to that higher functioning where more is asked of them and more would be demanded of them. And they're ambivalent about, sure, they would like that. They want to get back on that trajectory they had, but at the same time, they might be terrified that, will they be up to it and can they maintain um, while taking on so much more. So as I was saying before, I'm quite proud of how well we've done helping young adults and addressing their symptoms of PTSD, their symptoms of depression, symptoms of anxiety, to get back to what they want to go to, or I'm sorry, to get back to what they think is in their best interest at this time. And I know that's a fairly general statement, but I think that's where we're often quite successful, and we're often quite successful because we have so many staff, able to help these young adults where they're saying, I left this, I left A, I don't want to
Yeah.
return to A. Can we come up with something that might be better for me that's still structured, still demanding, but won't maybe have as many of the tolls that A took on me. And so we're looking at a B for them, right? We're looking at a location B. And we've had a lot of success that of reinventing the wheel a little bit and saying, you were
Right.
at that school for that reason. Might there be something, maybe closer to home if they're realizing that's important, or has maybe closer to a medical facility that has, world-class treatment. So we've done a really good job there as well. And another thing that I think that we've done quite well at is helping young adults get back to doing some of the things they were enjoying before and didn't think they could do before. And now I'm not
Mm.
talking about school or work, but I'm talking about one time we had a world-class swimmer who she was, excelled and even had Olympic aspirations, and then physical health conditions kicked in, and then subsequently mental health conditions kicked in, and she'd gotten away from swimming altogether. And it was such a passion of hers, and she loved it. And even if she knew the Olympics had passed, that it just made her feel so much better. But she was
Yeah.
so distraught at the toll that her physical health conditions took on her, and it could, in her mind, robbed her of the chance to compete for the Olympics. She just got away from swimming altogether. And we were
Mm.
all quite proud and quite touched when she told us while in program that, based on the encouragement of her peers and staff, she got back into the pool, and and she remembered fairly quickly how much she enjoyed it and how good it felt and how good it felt to start her day swimming. And by the her discharge ceremony that we had, she was tearfully telling us how glad she was that, thanks to us, she said she rediscovered the waters. And
Love
that
that.
was just a great story of someone who'd, thought she would never go back to that, and then based on, through her, after her time in the program, she was able to return and remembered what an important part of her life it was.
I love what you're sharing here because I often think, as a rehabilitation psychologist, many times I feel like I'm half a therapist working on traditional sort of depression and anxiety, and
Hmm.
the other half is really problem solving the world, right? Like, what are your values? How do we get back to living a life that is, in Marsha Linehan terms, worth living? But like,
Hmm.
what are your goals? What are your values? And how might that have shifted because of your medical condition? But can you still engage in many ways? And so some of that is problem solving and being flexible
Yeah.
and almost kind of playing a little bit of a part in social work as well, in the
Hmm.
sense of like what are the resources that are out there. So it sounds like your program is also picking up on that side of things as well.
Very much. I'll often say to the young adults, I'll challenge them maybe on a Friday to like share with the group, what are your goals, or what are the updates to the goals you might have had, so maybe concrete goals. And again, like just like you said, not necessarily like related to depression and I'd like to socialize more, which tells me and others I'm less depressed, not just that, that kind of, but also, if I use the swimming pool or any other, I'll say, what is something that you would like to get back to. You don't know how to go about doing that, but you just know you'd like to get back to that, or at least some version of that. And then let us, and by us, I mean your peers, the staff, the program, let us try to help you get back to that place. So, again, going back to the swimmer, she wasn't necessarily looking to have times like she had prior to her significant physical health condition, but just getting back to the water was so important and so rewarding and so fulfilling. And we'll do that with others. Very much to your point, can we be a little flexible? Can we introduce some flexibility into their thinking so that
Mhm.
it doesn't have to be the way it was before or bust? It can be, okay, it's not quite the way it was before, but gosh, it's still fun, or it still feels good, or it's still great to do it at
Yeah,
90%, 80% of what I did before.
absolutely. I love that. Now I'm kind of thinking of the outpatient therapist here. What are some of the signs that you think they should be looking out for that would signal, hey, the person I'm working with, this young
Mhm.
adult that I'm working with, might benefit from something more intensive like this program?
Yeah, that's a great question, and I also it's something that I have to think about myself because in addition to this work I'm telling you about, I have my own what you and I would call traditional psychotherapy outpatient practice as well in the community, and so I have referred young adults here to any one of the number of the young adult programs I mentioned to you earlier that we have, and so really I'm looking for I would want the clinicians to think about are there has there have the improvements plateaued?
Mhm.
Are they maybe the rapport is still there, but the gains are no longer coming, and that's acknowledged by both the therapist and in this case we're talking about young adults, so by the therapist and the young adult, the gains aren't happening, and the thinking kind of collectively is just more is needed. I'd encourage those people to take a look at IOP. Of course, if the person is decompensating, where what they were doing before was maintaining the person, and now no longer, and the person is just struggling or suffering more, I'll encourage people to take a look at IOP. What I'm always telling people anywhere when I talk about this or any other program is I don't want to wait until someone needs to be evaluated for suicidality or someone needs to be seen in an emergency room on a Saturday night at 2 in the morning. I don't
Yeah.
want to wait for that point. We will definitely take those folks into our intensive outpatient programs, and we can do a very nice job with them. But the person doesn't need to be suffering that much before they're appropriate for IOP. If they're saying that um, they're doing okay in many ways, but it's just gotten harder and harder to go into work, or they're missing more and more classes, we'll have them consider an IOP. One of the things all of our young adult programs have done very nicely is partner with the counseling centers for a lot of the area colleges, because it's a real win-win if we can get a young adult to stay enrolled in campus and
Yeah.
stay enrolled in college and not have to take a semester off or a year off, whereas you and I know they may go home but have zero structure in place. And if we can
Exactly.
work with these colleges and college counseling centers to say, hey, could we shift their course load a little bit so they can come to us those 3 days a week, three-hour blocks a week, and maybe they drop a class but not a whole semester, and they can stay
Mhm.
engaged in school and with their friends on campus and yet still come to us for treatment. We've been really successful there with a lot of the area students coming from area colleges.
And what are the admission criteria for the program?
Really, I mean, what I mentioned before in terms of, as long as, and I often say this in that initial screening call, if the young adult or if the referring provider thinks that the young adult has a physical health condition and the symptoms of the physical health condition are exacerbating their mental health, or their mental health is exacerbating um, their ability to care for, I should say, is affecting negatively their ability to care for their physical health. And if it's one of those, or both of those, and they're in that 18 to 26 range, and all parties think they can participate in the groups such as the ones I described to you, they're an appropriate referral to our program.
Okay, that's great. And, gotta ask this, are there any insurance barriers to people participating in the program?
So one of the things I really like is that we are affiliated with Hartford Healthcare, and that means that we take every insurance that Hartford Healthcare takes for any physical health procedures. We take on this side of the campus as well for our mental health program, and so fortunately, most of the young adults, the vast, vast majority of the young adults who come through, their insurance is accepted. As you and I know,
That is, yeah,
some of the
fantastic.
that means now that may mean that sure, but if you're looking at a 6 week program, 3 days a week, you're looking for 18 IOP days. Some of the insurance providers, as you and I know, they're great about saying absolutely, we know what IOP is, and we've authorized 18 days. Others say, well, we're going to want to do a review every 3 days. So that can be a challenge,
Yeah.
but at least we take all the insurances. We've even been able to work out kind of case by case contracts and agreements for folks who come in with out of state insurance that the hospital doesn't normally accept. We can work out something with those. Um, and giving you that, I give you that a second ago, that scenario where we have some really tough insurance reviewers folks, and they're really making it hard for us. We're never going to discharge someone who needs our level of care prematurely because the insurance company is pushing back so much. If they need to be here, they need to be here.
Mhm.
But like I said, knock on wood, we've been very fortunate we have very good folks in UR on our side, and they can really, advocate for our parents, advocate for our patients with the insurance companies they're dealing with.
Yeah. Now, I'm just wondering about sort of sharing your message wider and farther. Do you or your program do consulting with other hospital systems or clinical programs or things like that to try and build more models like yours around the country?
Yeah, we've had other programs reach out to us about launching something like this, either this very specific program or young adult treatment in more broadly speaking, because as you and I know, a lot of places might group young adults with their 18 and up population, which
Yes.
is adults and just adults. And a lot of the young adults say to us, they'll either drop out prematurely or not go at all because they're just not comfortable being grouped with people in their 40s and 50s and 60s, their words.
Yeah. Yeah.
And so we do a lot of consultation with other places, frankly, across the country who are interested in developing young adults. And then for those who are interested in developing specialty tracks, we can talk to them about the track you and I are talking about, as well as several of the other specialty tracks I mentioned. Um, and that's always a good conversation. I'm excited in improving access to folks who have these conditions I described, but just coming to Hartford, Connecticut, or California or Chicago is just not feasible. And
Mhm.
they're in a part of the country. So I'm always interested, and I always welcome people reaching out to me and saying, "Hey, we'd like to develop a co-occurring program like yours." And I will say we've gotten a number of calls already. I mean, a lot of calls actually since we opened now almost 5 years ago about people saying, "Wow, what a great program." Or they'll say, "I wish I had something like that for myself when I was a young adult." Um,
Yeah.
and people asking, what about doing something for children and adolescents? What about doing something for adults? And
Yeah.
so both internally and in that more consultative role, we're having conversations about that as well.
That's great. I would love to see more of this across the country for sure. Um, do you have any future goals for this program? Are there any plans for expanding it, improving it, changing it? Kind of where do you see the future for this program?
So we're always up for improving it, and we do that based on a lot of it is based on the feedback of the young adults who come through our program. And in terms of future goals, that if the demand is there, we can always expand both on this campus. We could expand here in Hartford. We could, we're part of a larger system. So in the future, what I would like to see is an in-person program in maybe a part of the state that's a person there who lives in that part of the state. It's just too far to come to Hartford three
Mhm.
times a week, but they're just geographically speaking, they're maybe much closer to the New York border, and so they a program in that part of the state would be great. And again, just any part of the state where it's just too far to come to us, but the demand is there.
Yes.
And then, as I mentioned, another interest of mine is definitely the virtual because I do want to reach those folks where there's neither there's just not an in-person option either currently or in some dream of expansion. And so what do we do for those folks? And how do we reach them? And again, during COVID, we did have some of those folks where they were, bedbound and they were, propping themselves up and participating 3 hours a day, 3 days a week.
Yeah.
And I'm sad to tell you that I know we've lost folks like that because they just can't come to us right now. So I would say to answer your question, my hopes would be for in-person expansion as well as a robust virtual option.
Yeah. Yeah, that makes sense. I mean, I can think of 2 people off the top of my head, one person who really needed full assistance to get into the hospital. And it was almost a full day of different kinds of transportation getting her from her house into the hospital system and it lended to her ending therapy pretty quickly.
Yeah.
And then another person who has seizures and so can't drive, doesn't have somebody to drive them. And that kind of person, probably wouldn't be able to make it. So again, I can see that there's like a certain subset of individuals that would really benefit from the virtual side.
Yeah, and
Um,
when you mentioned driving just now, we were very fortunate. I just want to preface by saying we're very fortunate. We know this is unique, but we had another donor family who was very impressed and touched by what the work we're doing in this program, and they gave us a donation that allows us to provide Lyft rides, Lyft or Uber rides to folks who want to come, who are good candidates to come, but as you mentioned before, they either can't drive themselves, don't have access to a car, there's no one who can drive them. And so we have a number of patients who come through who are able to take advantage of these donors' generosity,
That's
and
fantastic.
they are getting transportation because in this state, there's, as far as I know, it's only the state insurance and particular types of the state insurance that provide medical cabs for transportation, but all the folks
Mhm.
with commercial insurances, they most of them, I don't think I know of any, none of them provide transportation. So
Right.
it's just we're incredibly fortunate to know that we have this fund that allows us to provide, like I mentioned, Lyft or Uber rides to folks.
Right. That's great. Now, I know your program is primarily focused on young adults. You did mention kind of adults.
Mhm.
Are there programs similar to yours that are for those that are 26 and older that you're aware of around the country or even within your hospital system?
Yeah, not like ours within our hospital system. Ours is the only one. This is the pilot program, which is this young adult population, because it's the population I was most familiar with.
Yeah.
So I know for a fact within our system, there's not a child version or nor an adult version. If it's okay, I might even ask you, did you find any adult ones? Because excuse me, I'm not aware of any. I mentioned the one in California. I think that's for kids. I mentioned the one in the Providence area. I know is for kids and it's more intensive. It's a PHP. I am not aware of an adult one, and I don't know if you came across any in your search.
No, no, I haven't.
Yeah.
I've come across kind of intensive rehab programs,
Hmm. Hmm.
for people who've had, like, a brain injury or a stroke, which might include some psychotherapy options kind of, um, as part of it, but not for somebody who's sort of medically stable, if you will, but having mental health challenges,
Right.
and needs to go back to something more intensive. Uh, yeah, it's been a challenge kind of searching for that, and I've primarily referred people to your traditional PHP or IOP
Right.
programs,
Right.
which have had varying success depending on the
Hmm.
person. Yeah. So I know we're coming kind of towards the end of our time here. I wanted to sort of end with a question about, are you aware of any resources or training opportunities, or other ways that individuals who are working, I guess, therapists who are working with these individuals in the community can gain knowledge or skills about this dual diagnosis of both physical and mental health concerns?
So I'm often encouraging clinicians who are interested, and obviously I'll include myself in that, to check out what kind of talks or grand rounds or seminars are being given,
Yeah.
even if it involves travel, because this is kind of such a niche, population that we're talking about. A lot of the health psychology literature has been very helpful. You mentioned it right out the start, in terms of acceptance and commitment therapies and DBTs. If they're not versed in those therapies, that can be very helpful and very useful if they want to take on patients such as the ones you and I are talking about.
Yeah.
Um, so I'd say that's and to not be shy about collaborating and reaching out to those who've been doing this or doing this longer, or as I did myself. When we hired in our first iteration, when we hired our health psychologist, pretty much right out of her postdoc year to start this program with me. She just had expertise that, despite my having 15 plus years on her, she just had expertise that I did not have. So I would pick her brain the way she picked my brain. And so people should not be shy about reaching out to colleagues and looking for, um, mentoring opportunities, et cetera, et cetera.
Absolutely. Yeah. I mean, I found a lot of resources going to different conferences,
Hmm.
part of the APA division conferences like the Society of Behavioral Medicine or
Yep.
rehabilitation psychology, and all of those communities tend to have individuals who really know this stuff
Right.
inside and out, which is fantastic. Is there anything else that you think I should have asked you that I didn't?
No, I think this was a lot of fun. I really appreciate you having me on and very comprehensive. And no, I think I would just say, that I want to, make myself available not only to people who are interested in maybe sending a potential patient to us, but as you asked several minutes ago, I would love to be able to connect with those in different parts of the country, or even different parts of New England, as well as different parts of the country, who'd be interested in setting up a program like this. And a lot of what we do, could version of this could work with children, adolescents. Version of this could work with, we've called them adults.
Yeah.
And so I think a lot of this, what we do here and we've got to know in our young adult program, is very transferable to those populations as well. And so if someone said, we'd really like to start an adult over here in Nebraska, not necessarily young adult, I'd be more than happy to talk to them about what we're doing. And if someone down in Florida said we want to do a child adolescent version of what you guys have been doing, I'd be delighted to talk to them as well.
That's great. Oh, wait, I have one more question actually, if you don't
Sure.
mind. Are you running any sort of research programs, or have you in the past for your program?
So we haven't yet, but we always, we're open to that. And if a student wanted to come through, even for like a dissertation project, because we get a lot of trainees coming through. I think
Yeah.
they, like you and I are talking about, I think they're very intrigued by this. So we get a lot of psychiatry residents coming through. We get a lot of psychology practicum students, as well as interns and postdocs doing rotations with us. Um, but absolutely, if someone was interested in doing more formal research or dissertation related research, we'd be happy to work something out.
Fantastic. Okay. It was so wonderful to meet you and learn about this program. It really excites me just because, I myself have run into so many people that would benefit from your program or something similar. So I really appreciate you taking the time to talk with me and give us more information about it.
Yeah, as I said, thank you again. I mean, this has just been great, and thank you for letting me, share with you a little bit about what we've been doing and what we're so proud of that we've been doing. And thank you again for having me on.
Absolutely. I hope our discussion today sparks further dialogue. I'd actually love to learn more from our community and listeners about this important topic. If you have any questions about today's episode or would like to share a comment or resources, please feel free to reach out to me via info@findempathy.com. We also have a Facebook group for mental health professionals called Let's Talk About Health Psychology. If you like our show, please like, subscribe, or leave a review. This helps others find out about us. Find Empathy provides continuing education. If you would like to learn more about our courses, please click the link in the show notes or visit learn.findempathy.com. While our education is free, for example, like listening to this podcast, the proceeds we receive from continuing education goes to support the maintenance of our website and the development of new content. If you're a mental health professional that specializes in medical topics, please consider joining our free directory. Go to findempathy.com and click on Get Listed. Finally, please know that the opinions expressed by the experts today are their own. We are not financially supported by any of the businesses or resources described in today's podcast. Additionally, any advertising that is published on the episode is chosen by our podcast hosting service and not by Find Empathy. The content provided today is for educational purposes only. Please seek the guidance of your doctor or mental health professional for any questions you might have regarding your own health or medical condition. Thank you so much for listening, and we look forward to you joining us in the next episode.